Guys, this is Doc Brown from Benchmark. I'm going to take you through navigating the medical and therapy section of Benchmark 54. You'll probably be familiar with the roster, and already I've told you what the incident tab is. Basically, anybody with an active injury or illness or medical attention, injury or illness, you'll see these in this area here. So we'll look at John Smith. So John Smith has an active injury, so that's the icon for injury. That's the icon for the fact it was a training injury, and this is the date that the injury began, and this is the number of days that have passed since his injury began. So to add notes to an injury, there is a short way and a slightly longer way. So a slightly longer way is you'd actually go directly into John Smith's page and then add notes to the medical tab or the incident tab. The quick way, however, is to navigate to it straight from the home screen. So essentially you click on the drop down, you pick the injury up, click it, and we're going to go straight into John Smith's training injury. So John Smith's training injury, all the notes in this section are related to this particular injury. So the injury was an ankle lateral ligament rupture grade 3. If we want to have a look at the audit details of that, we can do, and we can also hide them. Remember, these are put in when you put the injury in initially. All the notes for this injury are basically in a chronological order, a bit like a Facebook feed or a Twitter feed. You just see one note on top of the other, all chronologically driven. And if there's any older notes, then this will be available for you to select. So these are all the notes that we can see here, and what we're going to do today is we'll add a new note to it. It's pretty simple, but new note. So here we go, this is our new note form. I'll talk you through it. There's a few little icon buttons here. Review required, we've got defaulting to no. If you select yes, that will make a little mark against the player's name in the roster. So if you want somebody to review the player, for example, if you're seeing him after the game and then there's somebody going to be picking him up tomorrow, of course you're going to talk to the person, but just to highlight that the review is needed, if you click yes here, it will put an icon next to the player's name and it will alert whoever's looking at that player to make a review in the notes. We're going to say in this case review is not required. High privacy, this is for doctors, so if you select yes here, whatever you write in this area will only be available for other doctors to see. So I'll leave you to your own judgment to decide when you would use that. If you want to use this, you can. Next game chance. Some clubs like to use it because it goes into the coach's report. Other clubs do not. By default, you don't have to use it. There's another button here, coach report, yes or no. If you check this box, whatever you write in here will go into the coach's report. And just to give you an example of how clubs would use something like this, coaches do have access to a coach report. They can download it whenever they want. And some clubs will write some notes in here. For example, player is perhaps taking part in training sessions but has modifications to the session. They'll write in the modifications in this area, click yes on the coach's report, and when the coach downloads it as a PDF, he'll see that information written in his report. It's defaulted to no, however. So let's do a review note on John Smith. So he's got an ankle ligament injury, so it's an assessment note and treatment, so we're going to label both of these, and actually it was a case review, so a few of us got around together and we discussed this case. These labels are quite useful for organising and finding information later on. So, you know, if you had a head injury, you might do a scat note, for example. If it's a rehab plan attached, you click that, so we'll do that in this case. If it's a surgical note, specialist has had medication injections, laboratory radiology request or results, click on these. And these are just a good way to index your information so you can retrieve all your case review notes, for example, at a later date. This is a free text area. You may be used to having subjective or objective, etc. We did have that, but it was quicker to actually just allow free text. And if you just want to put your headings SOAP in, by all means do that. On a mobile phone, you can dictate directly into this, and if you have voice recognition software on your PC, this benchmark will actually work with that. So you can use it. In this case, I'm going to write some free text. So yeah, here's review today. If you're going to do any investigations or injections or any kind of therapy activities, we suggest you use this area. It's all coded. It means you can review all the information at a later date. So, for example, here we'll say, okay, I had a late ankle strain rehab, user game ready, and there was some deep tissue massage and mobilization of this ankle. Optional status, well, it's changed from acute management to some indoor rehab now. It's progressing as expected. So I've clicked here defaulting it to yes, but we can't actually say no, he's not progressing as expected, and then it'll ask for a reason. Perhaps he's not been compliant with treatment, or treatment's been unsatisfactory, or perhaps we're awaiting some results, or had a further re-injury. But in this case, we'll actually say progressing as expected. You can add files to the system, any kind of file you want, pictures, etc., reports, rehabilitation plans, whatever it may be, and then we'll save the note. So the note's been saved, there it is, progressing as expected. The status is now indoor rehabilitation, and you can see that's reflected here. It's due back in 14 days. Again, you can change that at any time in the note. So if you need to edit the return to training day, for example, you edit the note here. And see, we've done ankle sprain rehab, deep tissue massage, getting ready, mobilisation. These were our tags that we put within the notes. And it was created by me at this particular date and time. So every log in the note is logged in the system. It forms part of the audit trail, so we can identify who did what and when. So that's how you add a new note. We are linked also with health partners from the perspective of you can create a pre-authorization to health partners. I'll show you this quickly. So let's say, for example, we needed to do an MRI on this ankle. We can pre-notify health partners using this form. It will load up in a sec. So this is a pre-notification from health partners, and it will embed the details in already, or certainly most of them. So it embeds the player, the contact details for yourself, player's date of birth, the injury, the type and the part. That was his injury here. Anything that you want, for example, you might want an MRI, left ankle, put that in there, date treatment requested, and it was for the 10th of August. And the hospital provider, let's say it's Spire Leeds. and here it was. Any notes that you might want to add. So that basically, if you then fill that information in and you save it, I'm not going to save it, but if you do save it, it will go directly to the claims pre-notification centre at Health Partners. So it's just a quick way of you sending them pre-notification. Not only will it go to them, but it will make an entry in the notes to say, yeah, that's been done and dusted. Again, it forms part of your audit trial. So we'll go back into John Smith because we're not going to notify Health Partners. The internet's a little bit slow, I think, in the hotel that I'm staying in. But anyway, there's your notes. Just quickly, you can see all the medical notes in this medical tab. The performance tab is literally for performance-related notes or notes that are not related to a particular injury, mobilisations, perhaps pre-activation stuff. Podiatry input where there is no injury, massage, pre and post matches, maintenance treatment, all that sort of stuff, that will go into the performance area. And again, it's very, very similar, you just add a new note, it's a little bit less complicated. It just gives you areas to write a note and then save. The medical tab is all of the notes together. So just to show you what I meant about filtering the notes, if I click on this case review button here, it will just pull up any notes that were linked to case review. So all notes that were linked to case review have been pulled up here. Get rid of that, and so actually I want to see all my TUE notes, then I can see all my TUE notes. It's just a very quick way to filter through your notes. The other thing that you can do from the medical tab is you can create a referral letter, and it works along the similar lines of the Health Partners form. So a referral letter would be, for example, you referring this athlete to, for example, a surgeon for a procedure or something along those lines, or an opinion. Again, the internet's a little bit slow. It's raining today, so everybody's in the hotel, I think, watching movies. But here is your referral letter. So here it's asking you to select the injury. So we're going to select the ankle lateral ligament, put in the specialist name here. In hospital, so Spirey, for example. Player's name, date of injury. This is my contact. This is our logo for the club. It's not high privacy. I can write in some text here. Please instability. Query. And again, your valedictory is configured when you're setting the system up. And if we create that, then basically it will create a note in the system. So this is our referral request here that we've created, and if you download it, it will produce your letterhead in a PDF that you can email off to your specialist. Good thing is, though, it's made a note, an audit that you have done a referral request to the specialist. So if anybody ever questions, "Oh, did you send that off?" Yeah, you've got it all in there. It's all audited, done and dusted. Now, like I say, it pulls a lot of information in and builds your letter. I'll show you a little example of what it looks like in a second once it loads. There it is. Open that up. So that's it as a little PDF. We'll go back in to the system. that is pretty much it from the perspective of adding notes to a player. I will go through how to add a new injury or a new illness in the next demonstration video. Cheers.